In recent years, there's been an accelerated use of digital innovations to improve the quality of perinatal care. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter with AHA. Technology has become a critical aspect of healthcare delivery. Digital solutions have provided avenues for improved access to OBGYNs, doulas, lactation consultants, specialists, and more. Apps for remote patient monitoring or chat and text based navigation services offer additional ways to support and coordinate care. Joining Priya Bathija, Vice President of AHA Strategic Initiatives, is Dr. David Ghadisha, Baltimore Regional Director of Women's Health Services at MedStar Health. Dr. Ghadisha shows how the use of PeriGen, an obstetric decision support software, has improved perinatal outcomes. This podcast is part of AHA's 7 and 7 series.
Thank you, Tom. Dr. Gadisha, thank you for speaking with me today.
Thank you very much for having me here. It's a pleasure for me and MedStar Health to be part of this broadcast and making sure that people are aware of what's going on and how we are protecting our patients in our hospitals.
Wonderful. And at MedStar Health, you're utilizing PeriGen's technology and services to improve perinatal care. Can you tell us a little bit more about how it works?
We have acquired PeriGen about 10 years ago, and we have been working with PeriGen to create a better product for our hospital, especially for obstetrics and gynecology. We recently, as recent of last month, we have acquired obstetrical PeriGen for inpatient that helps us find out about the patient from A to Z. The patient's been seen throughout their prenatal care all the way to the time they deliver and the time that they go home. We can follow that. There are also better fetal heart strip or fetal strip that we can see and follow when the patient's in labor. And that gives us better understanding of what's going on with the baby. Most importantly, with the moms that are high risk, that's helpful to make our management and treatment easier and help them deliver a baby, a healthy baby, and have a healthy mom after delivery. Also, we have what we call the vigilance that tells us if this program would tell us how mom's doing in labor. Is the mom progressing well in labor or not? And what other treatment can be offered the mom to better continue their labor and hopefully have a easy vaginal delivery as opposed to a C-section.
Wonderful. And what are some of the outcomes and successes that you have seen since implementing this solution?
This solution have given us a confidence to better able to diagnose fetal abnormalities and maternal abnormalities in labor. We can follow a mom and a baby throughout the labor, make sure the baby's fetal heart strip is appropriate, or what we call the category 1 throughout the labor. This particular PeriGen program will notify us or alarm us with any abnormalities or any change from the norm that sort of tells us to move in with a different treatment or appropriately change our treatment to manage what's happening right now for the fetus. That gives us obviously much better chances to have a healthy outcome for mom and for the baby. It is very important to understand that these days, especially in large cities, high risk pregnancies are not as much as a problem as a concern for a lot of patients and a lot of doctors. These programs like PeriGen helps us manage these patients much better and without a physician or nursing error. So if there's a normal fetal heart rate strip and for whatever reason the nurse or a doctor may not be able to see them or even pick them up, this programs alarm us with lights, with colors, with bells, and whatever you have that to tell us that this is a problem. It needs to be dealt with. Now, it would be done clinically with a physician and a nurse, but at least we have that sort of a fail-safe mechanism to get us to the patient's room and address the issue, whether it's very important or not.
So, is the patient aware that this is happening behind the scenes?
No, patient is not aware. Patient only would see the nurse and the physician that are caring for them. Something happens, they will definitely will explain the situation to the mom and say, what are we changing our management, or what are we doing to recess or remedy the issue that we have in hand? But they would not hear, nor they would know what's going on behind the scene.
How have your care teams responded to this? You mentioned earlier that it gives you more confidence. So I assume that they must be embracing this, but how has the response been?
The response has been great. We know as a department and as even a discipline, obstetric and gynecology, that we don't know everything. We are in charge of a very delicate treatment and management of a mom coming and have their delivery here at our MedStar hospitals. We are determined to make sure, committed to make sure that this would happen without a hitch. That we have both healthy mom and healthy babies, because this is a very important day in their family. So we all, as physicians and nurses, we all embrace this program because it does help us better manage and better safely, most importantly, manage these patients in labor. Again, some of them may be high risk patients that they need more attention from us, and this particular program, especially PeriGen, helps us do that, and that's what we appreciate this program for our patients and for us.
So, what comes next for MedStar and PeriGen as we move forward?
With the new programs we have, it's a combination of many things that is happening for us in MedStar. Most importantly is, again, better understanding of fetal heart sort of rate and system and patterns in throughout labor. And number two, how well the mother's doing in labor. And that's our vigilance program.
That's great to hear. And thank you, Dr. Gadisha, for
Sure.
sharing the great outcomes your patient population have experienced after integrating PeriGen. To our listeners, thank you for joining in. You can listen to more podcasts in the 7 and 7 series at www.aha.org/7 and 7. Thank you.